We begin tonight with the first cases of measles in Arkansas since 2018.
A larger outbreak has been brewing in Texas, and now 2 confirmed cases popping up here in just one day. Thank you for joining us. I'm Faith Woodard.
And I'm Rolly Hoyt. Health officials report both patients are under 18 and caught the virus while traveling out of state. The main concern tonight here is where they went to get diagnosed and how many people they may have exposed. So new tonight at 10, THV 11's Catherine Rowley breaks down what you need to know and why some adults might not be immune.
I mean, it's like the most highly contagious disease that we know of.
The highly contagious disease broke out in Texas earlier this year with more than 500 cases, most of those in unvaccinated individuals. Now 2 cases have been confirmed in Arkansas, one in Saline County and the other in Faulkner County.
Measles a lot of times I think we think of as a virus with a rash.
That's Dr. Josh Lyon with the All for Kids Pediatric Clinic in Little Rock. He explains what to look out for before that rash appears, which could be 3 to 5 days until the illness.
And so what you're really looking at on the front end of measles looks like a lot of other things we see. It's cough, it's runny nose, it's red irritated eyes, and it's fever. It's viral things.
Dr. Lyon, like most of the medical community, has been watching the measles cases in Texas rise.
Honestly, it's terrifying. We see a lot of kids here every day, and I take a lot of really good care of my families, and they're really important to me. And this is something that while we knew it was coming is still really hard to prepare for.
But as Dr. Lyon explains, for someone that's unvaccinated to measles, they are 90% likely to catch it if they come into contact.
And one of the reasons it's so contagious is it lingers in the air. It lingers on surfaces for a very long time. So it's one that as you walk through a room, it will linger in the air for about 2 hours behind you. It will linger on a surface for about 2 hours behind you.
After 2 doses of the MMR vaccine, your immunity goes up to 97%. But not all adults could be immune. Ann Pace, pharmacist and owner of Kavanaugh Pharmacy, says if you were vaccinated between 1960 and 1970, you've got the inactive measles vaccine used during that time, which is not as effective as the ones that are used today.
It would be important to either get revaccinated if they know that they got this inactive virus because it was shown to be not as effective at preventing measles.
While most people are eligible to get the vaccine or be revaccinated, there are some that aren't.
Pregnant women should not get the vaccine. If someone has a severely compromised immune system, should not get the vaccine as well. And if we've had any severe allergic reactions or severe reactions to other vaccines.
But once measles cases start, it's hard to tell when the end will be in sight.
Once it starts, it's so contagious. I mean, we think back to COVID and how contagious COVID was. Measles is far more contagious.
In Little Rock, Catherine Rowley, THV 11 News.
All right, Catherine, thank you. Now, all the locations that the health department says these 2 infected patients visited and their times, they're all hospitals and clinics. We've listed them in the online version of this story.
We also have more information on the vaccine and how you can get an appointment there. You can find that right now on our homepage of THV11.com.